Medicines can prove to be fatal in a lot of cases. All medicines are poisons. These are the statements that can be made by a general practitioner. Now, why is that so? In a layman term, we can just term it why are all the medicines toxic? Because if they're not toxic, they won't act on the human body. Their actions on the human body are in the therapeutic doses are basically the cause for their therapeutic indications. So if they are given to a wrong person at a wrong time and in the wrong dosages, they can prove to be fatal in a lot of people. So all of this is discussed over here in this section. What are the autopsy investigations that have to be carried out whenever we suspect a death that is related to poisoning by medicines? Any prescriptions that were made routinely even, for example, the analgesics, the antipyretics, the anti-inflammatory drugs, even the anti-diabetic drugs, all of these are the routine prescriptions that are made by a general practitioner. Now, how can they prove to be toxic in a lot of people? That is discussed over here in this section. In analgesics are the particular significance is given to the analgesics because they are the routine over-the-counter prescriptions that are given to the people. So again, one thing that has to be kept in mind is the over-the-counter drugs that are available to the people, that will be basically forming an ease or forming a stage for the poisoning by the medications. So these has to be basically stopped at any level, and the availability has to be made in a prescription form. A prescription has to be there made by a doctor, and only then the medications, even the analgesics and the antipyretics, have to be given on the prescription of the doctor, and that is not being followed in a lot of developing countries. So that is basically causing poisoning by medications. Over here in this section, we'll be discussing the results of the laboratory tests that are performed in a death that is suspected to be caused by the medications, even the over-the-counter medications, and the aspirin and salicylates. So aspirin is an antipyretic, an analgesic, and an anti-inflammatory drug. That is also known as the N-acetylcysteine. So what is basically causing the toxicity in such a case when aspirin is taken in large doses? And the other salicylates, even they can be caused poisonous in a lot of cases. So paracetamol is again an antipyretic, an analgesic, an anti-inflammatory even, it can be put in that section. And so how it can cause toxicity in a lot of people, what are the autopsy findings that are found in such cases. So that is basically the mainstay of this lecture over here. Now the autopsy investigations. Now, we have to keep in our mind that whenever we suspect death, which is caused by medications, it is sometimes very difficult to investigate such deaths because there are a lot of findings which can correlate to even asphyxiating kind of a death. Even that congestion is found on the face, the redness is over there, the swelling is over there, and so that can be basically confused with the asphyxiation deaths. And so we have to basically draw a borderline and perform some of the sampling tests, for example, on the blood, on the urine, and even the breath tests can found to be of significant values over here. Now, the lack of characteristic autopsy characters. Again, as I've already told you, there are multiple medications and there can be a lot of pictures in our mind. So it's only the practice that makes the forensic practitioner perfect. It's basically the exposure that he had to the cases. So he'll be quite sure that this death is caused by some sort of a medication that the patient was already on prescription. Little or no physical evidence. So we have to keep in our mind that sometimes only the normal prescribing drugs are lying over there on the crime scene, and even the normal medications such as insulin in a patient who is suffering from diabetes. So that we would not have in our mind, as insulin is present over there, he may be taking the insulin. We have to basically confirm the death by insulin by the histopathologist and of course by the blood samples. So the physical evidence is not present over there. And the widespread membrane ecchymosis is sometimes seen in the aspirin poisoning. So ecchymosis are basically the patches of hypostasis or the patches of the blood hemorrhages that are seen on the mucosal surfaces in cases of the aspirin poisoning. And aspirin can also be detected in the rugae of the stomach, especially the fundus and the cardia of the stomach. And so that has to be sent to the histopathologist to confirm the aspirin poisoning over here. Now, the results of the laboratory tests, they're again very important. The results can be, I'm talking in general right now, any medication-related poisoning, whenever we have it at our hands, we have to perform some sort of technical assays over here. So they can be a lot of blood tests that had to be performed for the detection of the kind of poisoning that we are dealing with. Now, there are a lot of qualitative and quantitative analysis that are performed on the blood samples, on the urine samples, and on the samples of the CSF even. They are carried out on all of these samples, and even the tissue samples are sent to the histopathologist for further assays. Now, the toxic concentrations of drugs. So, whenever we suspect any kind of poisoning, they have their own specific toxic symptoms and signs. For example, over here in this diagram, a summarized view of the opioid overdose sign and symptoms is given just to give an overview that there are particular signs and symptoms for specific toxicities. For example, over here, you can see that the breathing will be slow. So there will be dyspnea or difficulty in breathing. The lips and nails are blue in opioid poisoning. The person is not moving. He is getting the feeling of choking. There's gurgling sounds or snoring sounds over here in this opioid overdosages. And he cannot be woken up by ease. He is in some sort of an unconscious state, and the skin feels cold, and there are tiny pinpoint pupils. So these are basically the signs and symptoms that will show the toxicity in cases of the opioid overdosages. So the practitioner, whosoever is carrying out the case in the live person of a toxic person who has arrived in an emergency in an ER, and you're working over there as a medical officer, so these signs and symptoms will point towards the opioid overdosages. The pointing out of the problem is again very important by the medical legal officer, whosoever is working. The decline from the post-ingestion survival, how he is deteriorating, what were the signs and symptoms noted down by the medical legal officer of the ER is again very important. Conversions to metabolites. So conversioning to the metabolites is again making this case difficult for investigation, because we won't find the exact toxic substance in the blood. It will be converted to its metabolites. So again, the knowledge of the metabolites is again very important. What is the metabolism of all of these drugs in the human body, and what are the metabolites that can be found is again very important to be known to a forensic practitioner. The analgesics. Talking about the analgesics, or in a layman term, they are basically the painkillers. So most oftenly, the painkillers or the analgesics that we take are also, on the other hand, they are anti-inflammatory and antipyretic, that is fever releasing or fever relieving drugs. And so they are given even over the counter in a lot of countries. And their toxicity is very common because they are very easily available to whosoever is performing, whosoever is taking intentionally the overdosages by the suicidal intention. The aspirin and the salicylates are very important over here. The aspirin, in the chemical terms, it is known as the acetyl salicylic acid. And the self-poisoning is again very important. Self-poisoning means that the person has an intention of a suicide. And again, the accidental poisoning is very important, that is by children. So we have to keep that in our mind. Now, death by ingestion of 50 tablets, and these 50 tablets basically equals to 60 grams of the drug. So this is basically the fatal dose that can be administered by the person if he's performing suicide. So we have to keep this in our mind. Now the normal dosage is almost 3 to 5 tablets, and this is the normal dosage, and the fatal dosage is almost 50 tablets. So it is quite high, and the therapeutic dose is usually 325 to 975 milligrams. This is the therapeutic dose that almost equalizes to 1 to 3 tablets. That is all that a person can take in a single intake. Now, the symptoms of the aspirin overdosages are discussed over here. The person will have a double vision if he has toxicity. The uncontrollable shaking seizures are observed. There is burning throat pain, vomiting pain, decreased urination, and restlessness, irritability, excessive and unorganized talking. That is, he'll not be comprehensible. There is fear or nervousness, and there is dizziness, confusion, abnormally excited mood is observed in such patients. There are hallucinations, that is, these hallucinations may be auditory in nature or they may be visual in nature. He'll be seeing and hearing things that are not actually present over there. And then there'll be drowsiness, loss of consciousness, and a systemic kind of raised temperature, that is hypothermia or feverish feeling, will be observed. So these are all the symptoms and the signs of the aspirin overdosages observed in such a patient. Now, the aspirin hypersensitivity. So the aspirin hypersensitivity basically includes the urticaria, and there will be swollen lips, and there will be a feeling of congestion, there will be a feeling of choking. All of these are basically are included in the aspirin hypersensitivity, and this hypersensitivity will be observed even at lower dosages in people who are sensitive to aspirin. The long-term salicylate therapy sometimes prove to be fatal. In people who have multi-organ failure, for example, the metabolism of aspirin is not being carried out. So this long-term therapy with aspirin can basically accumulate the drug and raise its plasma level concentrations to the toxic levels. And that will again prove to be poisonous and fatal for the person. And that will be included in an accidental sort of poisoning by the analgesics or the aspirin. Now the aspirin, and we are talking about the salicylates on the other hand. What will be the autopsy findings in poisoning related to the aspirin and salicylates? On gross abnormalities, we'll just observe the findings on the surface. For example, all those signs and symptoms of the choking, the unconsciousness, and say, for example, there is some sort of an urticaria or swelling. All of these have to be observed and documented by the medical legal officer, whosoever is writing down the autopsy report. So that has to be documented in detail, and that will basically point out towards the poisoning by the aspirin. The vomiting or rare hemorrhagic manifestations, for example, the ecchymosis that I was pointing out on the mucosal surfaces, that has to be documented in detail in the autopsy report. The vomiting may be sometimes blood stained, and it may contain particles of the tablets, and that will basically indicate towards the poisoning by some sort of a medication intake. So that has to be observed. The color of the vomitus and the contents of the vomitus has to be sent to the chemical pathologist for further assays. Now, internally, mass of the tablets in the stomach. So, stomach, the areas which are mostly concentrated are the fundus and the cardia of the stomach, and that has to be documented in detail. The gastric mucosa is again in an eroded form, and that has to be seen over here. And then there is frank hematemesis. What is this terminology? It's basically blood in the vomitus. It's known as the hematemesis. So melena is basically a terminology when there is blood in stools. So that is basically regarded to as the melena, and that will be observed in poisoning with the aspirin due to the frank bleeding internally in the stomach and even in the intestines. Now the mucosal petechiae and the ecchymosis in the stomach, that will basically be due to the blanching effect of the aspirin on the mucosa of the stomach. So that is going to be observed over here. Now, talking about the paracetamol poisoning over here, the overdosages of 20 grams or more, or even potentially to some sort of lethal dosages, are observed in the paracetamol. Paracetamol, when we talk about, it's again given over the counter in a lot of countries. It's an analgesic, it's an antipyretic and anti-inflammatory in a lot of cases, and that is given quite easily. So the medical legal aspects observed over here can be suicidal, it can be homicidal, and it can be accidental as well. Now, the toxic compounds probably are the N-acetyl benzoquinone, that is basically abbreviated as NAB, and these toxic compounds are observed over here. The causes are centrilobular hepatic necrosis because its main metabolism is in the liver. So we have to keep this in our mind. Now, there is some sort of a delayed death even over here in the paracetamol poisoning, and we have to observe this type of death over here. The sustained release of the paracetamol is basically the management of the paracetamol poisoning. How are we going to treat a case of paracetamol poisoning? It's discussed over here in this flowchart. Now, if the dosages are more than 200 milligrams per kilogram or 10 grams of the sustained release of the paracetamol, possibly if it is in an ingested form, it can commence the N-acetylcysteine treatment is given over here. The paracetamol concentrations at 4 hours post-ingestion. If the presentation is more than 4 hours after ingestion, the above treatment line with the N-acetylcysteine is continued. And if it is more than 4 hours, if the answer is yes, then we continue the treatment of the N-acetylcysteine infusion over here, and we repeat these LFTs and the UECs, and the completion is done. And if the paracetamol concentrations are more than 120 ml micromole per liters or abnormal LFTs are observed in the lab investigations, then we basically cease the treatment with the N-acetylcysteine. And if it is a yes that the treatment, there are abnormal treatments, then we continue the N-acetylcysteine and consult a toxicologist. That is, a clinical toxicologist is observed in such a case. Now, on the other hand, if we continue the infusion of the N-acetylcysteine and repeat the paracetamol concentration 4 hours post initial concentration, then the above line treatment is given with the N-acetylcysteine. If the answer is no, we basically cease the N-acetylcysteine, and if the answer is yes, we continue with the N-acetylcysteine treatment and consult again with the clinical toxicologist for the further treatment and the further management. Over here. Now, at autopsy, the liver may be enlarged in such cases of the paracetamol poisoning because, as we've already told, it's basically the hepatic necrosis that is the mainstay over here. And then we have the pale yellow or the tan discoloration of the skin is observed in such cases. There is damage which is visible only on the histological site. So, liver tissue samples are sent to the histopathologist for further assays. Now, it's again very important that the time of investigation. So if it's stage 1, that means that the time of investigation is less than 24 hours post-ingestion. So the presentation will be anorexia, nausea, vomiting, diaphoresis, and normal lab test will be, the LFTs won't be deranged in such case of less than 24 hours. Then again, if we have the stage 2, that is the time of investigation is between 24 hours to 72 hours. There is an improved clinical presentation. The abnormal lab tests are there, increases the serum transaminases, bilirubin will be raised, and prothrombin time will be raised. And then in the stage 3, that is 72 to 96 hours post-ingestion, it's basically the signs of hepatotoxicity, ALT and AST will be raised. These are the liver enzymes basically. And there will be hypoglycemia, lactic acidosis, and the total bilirubin levels will be raised in such a case. The deaths due to multi-organ failure are common at this stage 3. Then we have the stage 4, that is almost 4 days to 2 weeks have passed on since ingestion. We'll have a patient who survived the stage 3. There will be a transient renal failure after 5 to 7 days, and there will be back pain, proteinuria, and there will be a complete hepatic recovery because the patient has basically passed on the dangerous stage 3. So these are basically the presentations that we can get clinically, so we have to keep these in our mind. There will be renal changes in the form of tubular necrosis, and that are again observed, and there are occasional myocardial fiber changes. There will be a sort of a cardiac changes observed in such a case. So in this section, basically, we dealt with the aspirin and the paracetamol poisoning in specific and how will we deal with it and what are the autopsy findings in such a case. That is the end to this section. Thank you for watching sqadia.com.